Okay, so this is a Trans Umbilical Silicone Breast Augmentation done by me 6 months ago. Absolutely gorgeous results, very, very natural. Her breasts are extremely natural. You cannot even feel that she has implants. That's how beautiful these silicone memory gel implants are. And she is extremely happy. She's shy, she doesn't want to talk, but she didn't have any bruising, no bleeding, no pain. She was walking 1 mile the first day, 2 miles the second day, 3 miles the third day, preventing a blood clot. The blood clot is the thing that can kill you. We never had anybody die. We want to keep it that way. But I want to give you a few things about the advantages of this procedure. Number one and most obvious advantage, if she was going to have these implants with silicone implants, she's going to have a scar right here or right here or right here, about this big, right? That's one. But then she's going to have another one on the other side, you know, like that. So the total scar is going to be about this big, you guys. Why would you want to accept a scar this huge? 2 scars instead of one tiny scar right here. I mean, look at this. This is just crazy. You want this tiny scar and the only natural scar of the body, which is the belly button, or you want 2 huge scars like this? That should be a no-brainer. That's crazy. And the risk of infection with this approach is 0. The risk of bleeding with this approach is 0. We never had a single umbilical infection or a single instance of bleeding. And the risk of capsular contracture with silicone implants is 0 in my hands. I did this procedure on July 20, 2025. If you want to have the Barbie look where it says I am implanted and you can see and feel the implants, okay, we can do it that way too. So with this approach, you can do it either way. There is a myth that you can only put them over the muscle. That's not true. The doctor that invented this, the reason why there is this myth is because the doctor that invented the transumbilical approach with saline implants back in October of 1991, Dr. Gabriel Johnson from Texas, he's now dead. He only put them over the muscle. But that's because he liked that approach. But most of the implants that we put here, over 99.99%, is very rare that we put one over the muscle. But if you want it, we can do it over the muscle. There is no limitation, okay? We can put it over or under the muscle just like any other approach. So this is incredible. I don't know why women are not requesting this. This is a procedure is the new thing. Having scars on your breast, that's a thing of the past. You have to, as a woman, say, hey, I don't want scars on my breasts or my nipples or my armpits. I don't want scars that are yay big, okay? And 2 scars yay big. I want a little tiny scar and the only natural scar in the body, which is the belly button. I don't accept and I don't want the higher risk of infection, the higher risk of bleeding, the higher risk of capsular contracture, okay? And also much less risk of pneumothorax, meaning puncturing of the lung, because we don't use electrocautery. A lot of times the pneumothorax that happen, and that's never happened to me, thanks to God, is because they use electrocautery and it burns the covering, the lining of the lung. And that could be a very serious complication. It could even be fatal. It's something that we never had, thanks to God, in cosmetic surgery. I've been doing these breast implants for a very, very long time and never had a case of bleeding, thanks to God, or pneumothorax, or penetration of the intrathoracic or intra-abdominal cavity. Those are things that, you know, would be extremely rare, right? It does happen to a certain extent, similar to like when you're doing liposuction, it could happen. It's never happened to me, thanks to God. But that's not a reason not to have the procedure, okay? A lot of these bad things that I hear are from usually, unfortunately, surgeons that are misinformed or they've never done the procedure and they want to put it down. And I encourage you surgeons to learn this procedure. Why would you want to put scars on the patient's breast? Learn, invest money and time and learn this procedure because this is the best thing for them. Okay, so this is the best thing for our patients. Thank you.